Surgical retractor is an surgical equipment. Look at this picture, shows that different types of retractor. Definition: surgical retractors are instruments used by surgeons to hold back tissues or organs, providing visibility and access to the surgical site. They help maintain a clear field and can be self-retaining or manually held. Types: first type, handled retractors. These require an assistant to hold them in place. It's classified into Army Navy retractor, double-ended, used for swallow or superficial incisions. Second type, Sen retractor, small with a sharp or blunt end, used in delicate procedures. Look at this different types of retractors. Second type, self-retaining retractors. These have a mechanism to hold them in place without assistance. Is classified into Beitner retractor, commonly used in orthopedic surgery with a ratchet mechanism. 2. Belfort retractor, used in abdominal surgery with adjustable blades. Third type, specialty retractors, designed for specific surgeries or body parts. It's classified into two. 1. Richardson retractor, used in abdominal or thoracic surgery. 2. Malleable retractor, flexible, can be bent to be desired shape. Parts. Look at this picture, shows that parts of retractors, a detail going on. First part, blades, the part that contract the tissue, can be sharp, blunt, or malleable. Second, handle, for handheld retractors where the assistant grips. 3. Locking mechanism, for self-retaining retractors to keep them in place. 4. Hinges, allow movement and adjustment of the blades. Uses of retractors. First use, exposure, to provide a clear view of the surgical area. 2. Protection, to protect vital structures from being accidentally injured. 3. Space creation, to create a working space within the body cavity. Precautions. 1. Sterility. Ensure retractors are sterile before use to prevent infections. 2. Tissue damage. Avoid excessive pressure to minimize tissue trauma. 3. Placement. Correct placement is crucial to avoid obstructing the surgeon's view or damaging nearby organs. How to use the retractors? 1. Preparation. Select the appropriate retractor based on surgical procedure and area. 2. Sterilization. Confirm that the retractor is sterile. 3. Positioning. Gently insert the retractor to avoid damaging tissues. For handled retractors, an assistant will hold them in place. For self-retaining retractors, adjust the blades and lock them in the desired position. For adjustment, frequently check and adjust the retractor to ensure optimal exposure and minimize tissue stress. 5. Removal. Carefully remove the retractor at the end of the procedure, checking for any tissue adherence to prevent injury. Thank you. Have a nice day.